Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
It is just disturbing that the federal government, the largest payer of healthcare in the United States, does not have audit rights to go in, open up the ledgers of the pharmacy benefit managers, see where the money is going.
Welcome to Healthcare Matters, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. He's Dr. Robert Popovian, joining us from our nation's capital, a pharmacist, economist, and chief science policy officer at the Global Healthy Living Foundation.
And across the country in Seattle, Washington, he's Connor Mertens, patient advocate and community outreach manager at Global Healthy Living Foundation.
Our goal is to help simplify the complexities in healthcare economics and policy issues for you, the listener. And first, we have some listener feedback from Apple Podcasts. User 2001 OABC writes, "We need this. Excellent take on COVID and the topics we want to hear." That review is from User 2001 OABC. Thanks for your review. We invite all our listeners to go to Apple Podcasts and leave an honest 5-star rating and a positive review. And wherever you're listening, don't forget to click the subscribe button so you never miss an episode.
Hey, Connor, let's get into this episode.
Thanks, Robert. Today we're going to talk about something that comes up all the time. This is a recurring theme in all of our conversations and across the healthcare in general. That's the lack of transparency in our healthcare systems. So many questions boil down to this need for more transparency. Why am I denied coverage? Why am I forced to take a drug B over drug A? Why are some of these drugs discounted and others aren't? These questions go on and on. So Robert, talk to me about transparency. Why is it so important?
Well, transparency is really the backbone of the healthcare system because patients are being asked to carry more and more the burden of out-of-pocket costs, whether it comes to hospital expenditures, their insurance premiums, their pharmaceuticals, and they need to know exactly what is it that they're going to pay out of pocket before they walk into a pharmacy, to a physician's office, for a hospital admission. I understand there are areas that we're never going to be able to predict. For example, if you have an accident and you have to end up in an emergency room, perhaps you're not going to be able to get the exact price or the out-of-pocket cost that you have to pay. But there are many instances that patients would benefit with better transparency in the marketplace, where it provides them the information they need to make appropriate choices for themselves.
I think we have to start at the beginning of this question, and that is, who is benefiting most from this ambiguity and secrecy, and then who's most impacted?
Well, it's impacting the patient, it's impacting the government, both the federal and state level, and it's impacting employers. Those are the three entities that really are paying for the healthcare in the United States. They're the true payers. It's not the insurers, it's not the pharmacy benefit manager. It's those three other entities that are being disadvantaged by this lack of transparency. It is well known that lack of transparency in healthcare has led to massive and inappropriate profiteering by all kinds of actors, and primarily the insurers and the pharmacy benefit managers, to the detriment of the true payers. Without a transparent health systems, patients can be harmed when they decide to enroll in an insurance plan that contains, for example, large deductibles or coinsurance. Such harm is befallen upon patients because they don't know and can't estimate in advance their out-of-pocket costs due to the lack of transparency.
Robert, my econ professor might not describe me as the most well-versed in economics, so why don't you help me understand, what about the people who say that too much transparency undermines the competitive marketplace?
That's a great question, because I'm an economist, as you all know, Connor, and I do believe that economic environment where individuals are bidding against one another in a blinded manner. Economic Theory 101 states that you will bid lower and it will suppress pricing. For example, if you and I are bidding for a television set and we do not know what is the price that we're bidding on, we will always bid either higher or lower. And if something is, we're trying to get a lower price, it will be lower ultimately because we're going to be bid against each other. And the blinded bidding does help that. But what I'm talking about regarding transparency is something different. It is information that the patients require to make more constructive choices. It is information that the employers require to basically make better benefit decisions for their employees. It is the information that the federal government needs to make policy decisions. Connor, I cannot tell you how many reports have come out of the Congressional Budget Office or the congressional staff that are intended to promote massive changes in our healthcare system from a policy perspective. Unfortunately, all of these reports have been derived from meaningless, outdated estimations of data instead of real world information. And one of the things that I see over and over again the government do is that either their complacency or their inability to ask for this data. After all, the federal government in the US healthcare system is one of the largest payors, whether it comes to pharmaceuticals or hospital expenditures or physician expenditures or other provider expenditures. It is mind-boggling how they do not have audit rights to see how much money is gained or transferred between entities in the market so they can come up with appropriate analysis when they're suggesting policy changes that is going to impact all of us.
Robert, that's a perfect segue because my next question is what legislatively is being done federally to promote transparency?
Federally, not much is being done. But fortunately, states, as usual, have taken the step forward to be able to introduce various types of legislation to create a more transparent environment. For example, in the state of Georgia, in 2020, House Bill 946 and House Bill 323 passed, and it required, for example, that the pharmacy benefit managers could not steer prescriptions for the sake of profiteering. And they had to report how much money they were making in form of concessions from the pharmaceutical industry and report back this information to the state government. Now, we need something similar on the federal level, but the states are really where the action is. Another example that is in Texas, legislation was signed this year by Governor Abbott that prohibited benefit managers from steering patients to their own pharmacies. So for example, Connor, if you're a CVS patient that you get your pharmacy benefits through CVS Health, this law prohibits CVS to tell you that you're mandated to pick up your specialty medicines, for example, your arthritis drug or your cancer drug from a specific CVS-owned pharmacy. And that is very important because that creates choice and it creates competition in the marketplace. And those are the two things that we need. And it provides ability for the state government to step in and say, we need better understanding of where these patients are going and also the flow of money. That's the next step that the state's going to have to do.
Obviously, it's very important to do work on the state level, but that sounds really incremental. What's going to be the most effective way to impact the most patients?
Well, definitely federal law. And the federal law, to me, it's going to be difficult to do, except for one thing, that where we can start with is really to ask for transparency in information. Currently, if you look at, for example, a congressional staff put out a report on drug price negotiation. If you peel back the onion and looked at that report, you realize that they're using data from 2016. And not only data, but estimations based on sort of testimonials that the pharmacy benefit managers have provided them instead of real world information, instead of real world data. It is just disturbing that the federal government, the largest payer of healthcare in the United States, does not have audit rights to go in, open up the ledgers of the pharmacy benefit managers, see where the money is going, whether or not all the concessions have been transferred to the federal government or not, in the form of rebates, fees, discounts, any and all, every single penny. And then to have more updated information, because as you know, Connor, healthcare is very dynamic, especially in the pharmaceutical space. Pharmaceutical expenditures go up and down all the time. And the reason that is because unlike any other segment of the healthcare system, pharmaceuticals have generics introductions or biosimilar introductions that plummet the prices of these medicines significantly. And because of that, you have to look at this information more in a real-time fashion over periods of time, long periods of time, to see trends. Unfortunately, again, they don't either have access to this information or they don't require these pharmacy benefit managers to provide them this information in a transparent manner. And this prohibits them from coming up with reports, analysis that then can be used to really shift the policy discussion in the federal level. So for me, and to answer your question about the federal level, is to start with getting information out that is accurate and updated and not rely on outdated information that is based on testimonials from the pharmacy benefit managers.
There's a few different pieces of legislation working their way ever slowly, as always, through the federal level, the No Surprises Act, the Safe Step Act, and a lot of these really do focus on this principle of transparency. Do you think that there is hope for finally for us to see some change?
I believe there is. The surprise billing legislation that you're referring is very important. It's something that every patient has experienced, surprise bills, when they end up going to a hospital to see a physician. It happened to me. Several years ago, I required a procedure, and I picked a specialist through my network that I can go to. When I ended up going to the specialist, which was in my network, this physician used an anesthesiologist who was out of network to provide me the anesthesia. And what ended up happening is that when I went home, about a month later, I got a bill from the insurance company saying to me that although my gastroenterologist was within network, my anesthesiologist was considered out of network, and I was responsible for the full payment for that anesthesia. Of course, in this case, the insurance company stood by me and did not let that happen, but that had to do because I wasn't aware of it. Nowhere it was written that I not only had to pick the specialist who was doing the procedure, that I was also unaware that there was going to be any anesthesiologist that was going to provide any kind of a procedure at that time to me, and that that individual was out of network. So yes, the surprise billing thing is important. But Connor, the most important thing is that we continuously strive for more and better information for patients, whether it's in pricing, whether it's information, so they can make more educated decisions. And not only for the patients, for this to happen, but the employers and the federal government.
As always, Robert, I'm learning more every day, but I want you to get the last word in. What should folks know about transparency in the U.S. healthcare system?
Connor, at a time when we're asking patients to carry more of the burden of the healthcare costs, whether it comes in form of deductibles, coinsurance, where it's an unknown, when we're asking patients to choose new health plans, for example, we need to provide them the information upfront. We need to provide them the information regarding to, is their medicine available on the formulary of an insurance plan that they're picking? Is their physician in network? Is their hospital in network? Before they sign up for those insurance plans. We're also asking them to, remember, carry a lot more burden of whether it comes in form of deductibles and coinsurance. And we need to provide them that information upfront to them so they can make more educated guesses. So for example, I know your sister just had a baby, and I'm pretty certain that she probably had some type of a coinsurance involved in her delivery. Having a baby is something you can plan for. Wouldn't it have been very good for her to know exactly upfront whether her gynecologist she wanted to use was in network? Wouldn't it have been very good for her to know what her out-of-pocket cost was for going, for example, to the hospital down the street or a hospital 3 blocks away? Those are the type of information I'm talking about that will help patients. Yes, there are instances we need to make urgent decisions. For example, if there's a car crash, obviously you're not going to shop around for an emergency room. But there's plenty of healthcare interventions, in addition to healthcare decisions that we make regarding our insurance, that having that information upfront is very useful. In addition, information just doesn't end with having information about pricing. It's information about utilization and spending and all these things that the federal government is using to make, again, massive policy decisions. So wouldn't it be a good idea that information is real time and available to them in the entirety instead of in bits and pieces and in form of testimonies or estimations? Look, it is time for this country to move forward with actionable policies that will help reduce healthcare costs. The ideal, most often synonymous with success of such policies, is the principle of transparency.
We can't deny that an informed patient is a healthier patient, and these ideas of transparency in our healthcare system are essential if we want to bring down costs and make a more informed patient.
We hope that you learned something too. We'd love to hear from you about transparency and what is the impact on patients and why is it important to you. Send your email to healthcarematters@ghlf.org, or better yet, include a short video or audio clip.
And who knows, whatever you share may be included in our listener feedback portion of future episodes. Thanks for listening to Healthcare Matters, a podcast that pulls back the curtain to help you make sense of complex healthcare economic and policy issues. If you like this episode, please go to Apple Podcasts and leave an honest 5-star rating and a positive review. And wherever you're listening, click the subscribe button so you never miss an episode. He's Dr. Robert Popovian.
And he's Connor Mertens. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.